COVID and the military had to go in?
Thank you for the question. You're absolutely right. Right? There were problems in our long-term care facilities. Some of our private, some of our publicly run long-term care facilities. And we're working towards improving those. The 4 hours of care that has been implemented through this PC government will ensure that there is enough staffing and enough care for our elderly residents. That is a program that was worked on by this government and in partnership with the Eastern Ontario Wardens Caucus, which I've been a member of for a while. Right? So we are moving to improve the standard of care. Right? Some of the other parties have suggested that they will ban for-profit long-term care facilities. Right? Banning for-profit long-term care facilities would cut the number of long-term care beds in half in this province. This is the time when we need to build new beds and work with whatever partners we need to have those new beds. This is not the time to be eliminating long-term care beds.
Now we'll draw another name, and so Rick cannot be chosen again to ask a question of. You're off the hook now for a little bit. So Emily will draw another name for us. And again, candidates, you don't have to ask a question of anyone else if you choose not to.
Next up is Ted.
Okay, Ted Darby, if you do have a question for another candidate, you are free to ask, and if not, that's fine too. He has a question. Come on up.
Oh boy. Okay, on the spot. Meeny, meeny, miny, moe. Actually, Joyce, I would be really interested in your perspectives from healthcare as a practitioner. If you had a choice of one thing that you would do to improve our healthcare system, what would it be?
In general, not at this climate, it's to maintain a staff-client ratio that works. But during COVID and since, how be we let those people back to work that were the mentors, a lot of them the seasoned crew, that were either let go because of a medical status or said, that's it, I've had enough because I've spent 1 million years holding people's confidentiality close to my chest. And now we're spilling it out. All I hear is, have you had your first shot? Well, how was your colonoscopy?